Hi everyone and welcome to Florida Hospital's Health Chat. I'm Jennifer Roberts. Once a month we pick a topic and provide you a Florida Hospital expert so you can get some answers to your questions. We have our conversations no more than 20 minutes over the lunch hour in hopes that you can get a little medical information that you might need while taking a little break from work. Today's topic is centered around family planning and what new parents can expect from their OBGYN and different ways Florida Hospital can help you prepare for having a baby. Our expert today is Dr. Ashley Hill. He's a Florida Hospital OBGYN. We've got a couple of questions here. I'm going to get things started, but we'd love for you to participate too. So please submit those questions right there on the web page, or you can also use social media to do that as well. The doctor's here, so let's get started. Dr. Hill, welcome.
Thanks, Jen. Thanks for having me.
Absolutely. Talk to me a little bit about, before we even get pregnant, what are some of the things ladies and families should be thinking, husbands and wives should be thinking about before they take that step to trying to start a family?
That's a great question. In the old days, people just show up when they're pregnant and doctors didn't even diagnose it until they're 12, 13, 14 weeks. Well, now we ask ladies to come in and their husbands for a preconceptual visit. And we talk about blood pressure pills and diabetes and their general health and vaccinations. We go over a list of their medications, talk adult conversations about the best way to get pregnant and how not to, how to time that the right way. And we talk about weight control and other things. And it's like a pre-pregnancy tune-up is what we call it.
And some of the things that you want to make sure that you're doing, if you can kind of just give us a little bit of overview of a few tips that you would share with your patients.
Absolutely. One of the things I talk about is weight control. And it's a tough conversation to have, but a lot of folks struggle in our country and elsewhere with weight control. We are finding out now that if pregnant ladies are heavy set when they get pregnant, or they gain a lot of weight during pregnancy, it not only can affect their health with things like diabetes, high blood pressure, increased risk of a C-section, but it can affect the baby. And those babies might have diabetes when they're older and have other problems. So not to put a lot of pressure more pressure on moms than they already have, but what you do before pregnancy can have a big impact on your baby's health.
And vitamins play a role in that, prenatal vitamins. I remember my doctor put me on those when we first started trying.
The studies show that if you are on a vitamin with folic acid, which we also call folate, ahead of time, maybe 3 months or so ahead of time, it'll help prevent certain birth defects. And the birth defects are really unspeakably bad, those particular ones. So that will knock that down by about 90% chance. So we absolutely recommend every woman take prenatal vitamins well before she wants to get pregnant.
So when you start having those conversations with your spouse about, okay, is this the time? Really, step one is to make an appointment with your doctor.
We absolutely encourage the dads and moms to come in, future dads and moms, to come in and sit down with us. It's a nice conversation. There almost isn't even a need for an exam a lot of times. And it's very, very pleasant, and people go away armed and ready, so to speak.
Yeah, sounds great. So let's say we've taken all of your advice, we've done what we were supposed to do, and moms find themselves pregnant. Talk a little bit about some of the things that you get a lot of questions about. I know you must hear a lot about, well, how can I exercise, or what can I do? Do I have to lay still? And all of those things that you kind of advice that you would give to moms as they find themselves newly pregnant.
The newly pregnant first-time mom is excited and scared at the same time. And she's getting a tremendous gigabytes of data from all over, from her family, her friends. Most of those folks, of course, are well-meaning, but sometimes the wives' tales, old wives' tales, they say, really aren't true. So one of the things that we do in our practice is to sit down and dispel some of those myths and go over the facts and get everybody straightened out on the same plan, so to speak, for a healthy pregnancy. So for example, we tell pregnant ladies to avoid hot tubs or super hot baths. If you can step in the bathtub without screaming in pain, you're going to do fine. But too much heat very early in pregnancy, the first few weeks, can damage the baby's spinal cord and brain. So that, obviously nobody wants that, so we say please avoid the hot tubs. Now, dad needs to avoid them before being pregnant because the soldiers don't like heat. So in this case, it's probably the hardships on both members of the team. We also suggest that pregnant ladies continue exercising. There is no more heart rate restriction in pregnant ladies. We just ask that they not exercise flat on their back because that decreases blood flow to the baby. And interestingly, they don't exercise while standing completely still. And that has been shown to decrease blood flow. So moving and exercising is good. And really, I think it's mostly common sense. Kickboxing is probably out. Scuba diving, parasailing, contact sports like football or maybe basketball. it's better to do walking, spin class, aerobics, yoga, those kind of things. But absolutely a great idea to exercise, and that will help your pregnancy.
Yeah. Do you have a favorite wives' tale that you love to dispel with new moms? What's your favorite?
There are quite a few. One is that raising your arms above your head during pregnancy causes the cord to come up and loop around the baby's neck. No, that's just not the truth whatsoever. And then there are, of course, the wives' tales about being able to spin a needle in your hand and tell if it's a boy or a girl.
Oh, right.
And there are a lot of times where I'll show the mom on the ultrasound machine, well, the needle trick didn't work.
Yeah.
It's going to be a girl or a boy. But those are kind of fun.
Yeah, very good. So, what can new moms expect at their prenatal appointments? So they're supposed to see you how often after you're confirmed pregnant?
The visit schedule depends on the healthcare needs of the mom and sometimes the baby. But generally, we like to see the mom sometime before 12 weeks. Now, first-time moms get very excited and they want to come in the minute the pregnancy test is positive, and they want to hear the baby's heartbeat. And it's tough to hear the baby's heartbeat before 10, 11 weeks, sometimes 12. But we encourage the moms to come in whenever it fits their schedule, but generally sometime the first 12 weeks. And we do an exam. It's kind of an annual checkup for pregnant ladies. Feel the size of the uterus, and a lot of people are surprised to find out that gynecologists think of the uterus in terms of the size of different fruits. And so or maybe a basketball, for example. And we measure the baby and we do an ultrasound, and if we can, we listen to the heartbeat, encourage the woman to bring her partner or family with her, and then we see them about every 4 weeks after that until the end of pregnancy. And then they actually come kind of live at our office every week after that, and then we have a baby.
Yeah.
And it goes by fast.
And some of those in-between appointments that you're talking about, the once a month, every 4 weeks, talk about what happens at each one of those.
I look at every different appointment as a chance to provide some education and get to know my patient and what her needs are and her goals are, and hopefully meet the family too. And if they've got kids that are old enough to understand, we bring the kids and let them participate too. They help find baby brother's heartbeat or help measure baby sister with the mom's tummy. But most of that's education, and a couple times there are labs to get during pregnancy, but most of the time it's just to go over what to expect while you're pregnant, and then later in pregnancy to talk about the birth plan and what to expect during the delivery. And a lot of ladies are pretty nervous. I mean, it's a huge life event. I guess similar to a wedding. If you haven't been married before, you're kind of scared walking down the aisle, right? And after you have your baby, you're a veteran now, and I remember a lady on her 5th baby, and I walked into the office, and she had the tape measure out to measure her tummy, and she said, I'm in a little bit of a hurry, I've got another appointment, give me the heartbeat checker, my heartbeat's fine, my blood pressure's fine, my weight's fine, do you have anything to talk about? Okay, well thanks, goodbye. And she was out the door. So she was a pro.
By that time, you know everything. But really, the prenatal care is very important as far as to make sure the pregnancy is going as planned.
The prenatal care is very, very important. And there are about roughly 13 visits. That's a lot of time to be spent down at the doctor's office. And we definitely appreciate the effort ladies have. You know, child care, their jobs, their schedule, driving in the rain, driving in traffic. But I would guess maybe probably 4 out of 10 pregnancies have some type of a high-risk condition that pops up or maybe pops up temporarily. And if you're not coming to be seen, we can't diagnose those at help. Can't do it.
It's good to know it beforehand. Some of the things, advice, that education that you talked about you give along the way. Let's talk about some of the foods that are thumbs up, thumbs down. What are your recommendations?
The food is also pretty intuitive, but it takes about 300 calories more a day for pregnancy and later on for breastfeeding. And putting that in a practical sense, that's about a cup of skim milk and half a sandwich. It does not take long to get to 300 calories. So we ask pregnant ladies, one, to not go crazy with the food because of the weight issue, but also, to try to be sensible about how they do that. And foods that you want to stay away from: too much caffeine. So I'd say more than 1 caffeinated beverage. And you want to heat up your cold cuts and your hot dogs and all that. So you want no raw food of any type. No raw food of any type.
Sushi's got to go.
Yeah, I just wouldn't take the risk.
Yeah. Makes sense. We do have a question that I wanted to get to from a
let's
viewer that's watching. Midwife versus MD when you're going determining who's the right fit for you. Talk to us about the difference and what you think about that.
You got it. I'm actually a big fan of midwives. My first delivery was by myself, and it was incredibly frightening. But after that, I was taught by my next 9 or 10 by certified nurse midwives in Tampa, and then the rest of those were a mix of midwives and physicians. So, and in fact, my intern year, My first delivery, I was accused of being a midwife because I didn't cut an episiotomy, I didn't use a vacuum, I put the skin-to-skin contact, asked them on to breastfeed, and the chief resident came in and said, well, you're supposed to be a doctor, not a midwife. And I took that as a compliment. So I think it's very individual. If you've got a certified nurse midwife who is under the, has collaboration with a physician, I think you've got the best of both worlds. And we actually are starting a nurse midwifery program within our practice, and we have 2 certified nurse midwives, Melanie and Stacy, who are phenomenal. And most ladies, there's no reason why they should not be able to have a nice midwife delivery and have someone like me kind of in the background hanging around just in case something bad happens. I think that's a great model. The British have been doing it for years.
Yeah. And some of the, just kind of describe what the difference is between a midwife and an MD, just if you're trying to make that choice.
It depends on the person more than anything, but in general, nurse midwives, certified nurse midwives, have a non-medicalized approach to birth, and they tend to have a lower C-section rate and a little more natural process without epidurals and other things. I have, on the other hand, ladies that come see me and say, look, it's my first visit, I'm getting an epidural. You can put it in now if you want. I'll carry it around for 9 months. I don't care XYZ happens. I just want to have my baby on this date, get back to my life, and move on. Other ladies say, no, I want to have a very natural delivery. And I think that both physicians and midwives can participate in both those. But nurse midwives really make an effort to deliver their patients as naturally as possible.
And I think we kind of answered one of the next questions, was the differences during the delivery time, and you just talked about that versus a doctor versus a midwife. So,
well, I have to put a little bit of a plug in.
Yeah.
And here it is. Our practice is one of the few in Florida and probably the country where one of our physicians is in the hospital 24 hours at a day. We are there. If I'm on a Tuesday, I'm there 24 hours. I go home the next day. And we do that for safety and for continuity. So most practices, the nurse midwife will be there a lot longer than the physician will. The physician kind of rushes in, does the delivery, gives everybody a hug, and writes on the chart and rushes back to the office. We're there. I've watched parts of football games. I remember one time a lady was a big fan of the Tampa Bay Bucks. First time they were going to make the playoffs in many years. It was all depending on a field goal. The baby was crowning. I mean, the kid's head was right there. She had a great epidural. She said, I just want to watch this field goal. So I stood there with my hand on the baby's head, and we all watched the field goal went through, and I said push, and we had a baby. And so being in the hospital really has remarkably changed the way we practice. And so both the nurse midwives and us, we're there for a much longer, I think, than most doctors are.
Yeah, that's great to know. Let's talk a little bit about the advantage of a team of doctors. You know, you talked about the nurse midwives in your practice, but it's not just you and them. There's a whole other group. Talk to me about, what are some of the advantages of having a whole team behind you?
I like the team approach, and we have set this up as a team. We have 8 physicians and 2 nurse midwives, mostly for the safety of being able to do the in-house call, because you can't be on 24 hours a day every day, and it's fatiguing to do it too much. And the other is that every person on our team brings something to the table in terms of education and personality. And most of our patients who have had 2 or 3 babies with us will tell you they don't have a favorite doctor. They rotate through all of us. They enjoy all of us. Each one of us has something to teach them. Toward the end of the pregnancy, they'll tell me, well, Dr. Boone taught me this, Dr. Blount taught me this, Dr. Font taught me this, and so at the end, it's almost like the analogy of going to a school where you don't just have one teacher to work with, you have a group of teachers for different subjects. And I think our patients get a lot out of that.
Yeah. And so you rotate through the practice, so every mom gets a chance to meet everybody along the way. That's kind of the idea?
We don't require ladies to rotate, but almost every lady in our practice wants to. So it's whatever they're most comfortable with. If they want to stick with one doctor, we can do that, although the delivery depends on who's on call.
Yeah. I wanted to ask you as well, what are some of the resources that are available here that you guys work with at Florida Hospital to help moms through the whole process as well? I know there's the office visits and the prenatal care is really important, but there's also other opportunities for them to have more education.
Florida Hospital set up a great program. There are classes for moms and dads on how to change a diaper, how to get a bath. My wife and I, when we had my son Alex, I think I had probably delivered about 4,000 babies by then. I had very little experience on what to do after. Here, you take the baby, it's out. So we took the class and learned how to take care of babies after they come home. There's a CPR class for baby children, there's a class for sister, breastfeeding class, anesthesia class. I encourage ladies to and their husbands to go to all of those, as many as they can. You know, education knowledge is power, and with that knowledge, if they have any trouble breastfeeding, there's a lactation program here that is state of the art. I mean, these ladies, I've seen them making rounds at 9 o'clock at night because someone has problems. They'll come in and see the patient.
Yeah.
It's really impressive.
Yeah. There's a lot of resources here available after the fact, after baby comes as well, to continue with the lactation nurses and that kind of thing too.
Absolutely.
So.
And we also have, if a lady has diabetes, there's a great diabetes education program, and so our patients, I think, come away really very well equipped when they take the baby home. And if and we have a ton of great pediatricians that are affiliated with Florida Hospital also.
Yeah, yeah. We kind of skipped this question along the way, but I wanted to go back to it. We were talking a little bit about how it's time to announce that you're pregnant. So we were talking about those new moms and that kind of thing. And some folks wait a little while. They want to wait those 3 months. Is that the advice, the medical advice that you would give, and why is that?
I ask my patients to wait until about 12 weeks or so, roughly, to make the big announcement, put it on Facebook, send out to everybody.
Right.
And the unfortunate reason is that there is a miscarriage rate, and it depends on the lady's health and how old she is. But, about 1 in 7 pregnancies end up as a miscarriage after the pregnancy test turns positive. In some cases, it's higher than that. So over my career, I've treated hundreds and hundreds and hundreds of ladies with miscarriages. It's a tragedy, and it's a worse tragedy if everyone in town knows you're pregnant, and now you have to untell them, so to speak.
Yeah.
So my advice is to do what OBGYN doctors and their spouses do, and that's wait till about 12 weeks. No science behind that. I just think it makes sense.
Yeah, yeah. Give it a little time to
Give it time.
make sure.
Tell your immediate family that's all right, but I think it's just adds to the devastation to have to tell everyone you work with and all your social media friends that something bad happened, I'm not pregnant anymore.
Yeah. Any recommendations from the physician side of things on when is the right time to get pregnant? Everybody wants to know, well, do I still have fertility left? Do I not? Is there a good time to start?
I just gave a lecture on this, and I looked up the average lifespan of a woman in the United States, and I compared it. I have a nice graph on this. It's right now, if you're a baby born today as a woman, your average lifespan is 81 years, which is the highest in history.
Yeah.
In 1850, it was 51 years.
Yeah.
Okay, so ladies back in those days, a lot of them never made it into menopause. Well, we all know that there are millions of women who live very vibrant lives up into the menopause and up until their 80s and 90s and 100s. The problem is eggs don't lie and ovaries don't lie. And so we always encourage ladies to think about getting pregnant sometime before age 33 to 35, only because the eggs can get a little older, and now you're down at the infertility doctor's office and you're talking about in vitro, and what became a fun thing with you and your husband becomes a job now, and nobody's happy about it. So I think late 20s, early 30s is optimal.
Yeah, yeah. One final question, we can wrap it up. I know somebody has some interest on our classes. Where can people get information on some of those resources that you were talking about?
Florida Hospital has a phone number. We can put this up on the website for prenatal classes.
Okay.
And the folks who run this are fantastic. And there's an appointment process that we give all of our patients. I don't have the number off the top of my head.
That's okay. We'll find it.
Freely available, though, and those classes, they run the whole year.
Yeah.
And so I would definitely encourage folks who are interested, even if you're thinking of having a baby, you just kind of want to see what it's all about. Come take the class. Classes are great.
Yeah, fantastic. Dr. Hill, thank you so much for your
Jen.
expertise. We appreciate your time. And that's all the time we have for today's Health Chat. Of course, if you want to make an appointment to see Dr. Hill, you can do so. It's really simple. Call 407-303-DOCS, or you can visit online at their practice's website. It's www.lochhavenobgyn.com. There on your screen. I also want to thank you for watching and for the questions we got that were fantastic. We appreciate people that participate in our web chats. You can find out more about upcoming web chats by liking Florida Hospital on Facebook. We'll be sure and give you all the information. If you've missed any portion of this web chat, check out Florida Hospital's channel on YouTube. This whole chat will be up there a little bit later on. Thanks so much for watching, and we hope you join us again.